Hi, my name is Dr. Becky Cox. I am a doctor and one of the two co-founders of the campaign Surviving in Scrubs. I work as a GP with a special interest in women's health and gynecology. Much of my time is spent working both in primary care and also at the hospital. Alongside that, I'm also an academic researcher with a special interest in violence against women.
Hi, my name is Dr. Chelcie Jewitt and I am an emergency medicine registrar working up in Merseyside. I'm also one of the co-founders of the Surviving in Scrubs campaign. I've had a keen interest in the health inequalities that women face within healthcare, but then that's now spilled over into the experiences of female and non-binary clinicians, which is what led to my work with the BMA and the Sexism in Medicine survey, and is now what kind of fuels my kind of want to be involved in our Surviving in Scrubs campaign.
Our campaign Surviving in Scrubs was launched last year after we had both experienced sexism, sexual harassment and unfortunately sexual assault in the workplace. We found that not much was really happening about this issue. It wasn't really being talked about. There had been some surveys and some research done, but realistically nothing was happening. Me Too had not come into healthcare.
Our campaign Surviving in Scrubs began as a website. Our website is still going, www.survivinginscrubs.co.uk, and on that website people that work in healthcare, irrespective of whereabouts in the country or what their profession is, can submit their anonymous stories in terms of any sexual misconduct that they've experienced at work, which can be sexism in the form of banter or crude comments, all the way through to sexual assaults, and unfortunately we do also have some stories of rape in the workplace as well.
Since the campaign has been going now, we've actually got more than 150 stories, which is incredible given we've only been running for around 10 months.
The aim of our campaign isn't only to highlight these issues, but it's also to challenge the culture.
We're currently working with healthcare organisations, including groups like NHS England, British Medical Association, the GMC and the Medical Royal Colleges.
The aim of our campaign isn't only to highlight the toxic culture within which we all work, but it's also to challenge that culture. So we want to see change from individual level, trust level, but also when it comes to our governing bodies and also the government itself.
So that there is better support for survivors and so that we can ensure that the workplace is safe for everyone.
As part of our campaign, we are working on projects, and they take the form of support resources for victims of these behaviours, education and training resources for employers and larger organisations.
Alongside that, we also go around doing talks, events to raise awareness about this issue. And we're also liaising with the government groups and organisations that I mentioned to push for change. We need to see accountability going on and we need to see that happening.
This is where our plea comes in. As of now, Becky and I have been doing this in our own free time, and we've been trying to work this around our full-time jobs. Not only do we now need to keep trying to find the time, but we're at the point now where we need to start trying to find some money so that we can fund all of these projects that we are undertaking.
So far, much of our work has not been funded, and we are now getting to the stage where we've created a lot of momentum. We're becoming nationally recognised, which is fantastic. But we need donations to continue.
Your donations would help us to fund the projects that we want to undertake, so the training resources, the educational programmes, and it'd also help to fund the continuation of our advocacy and campaigning on these issues. Any donations that you would be able to make to our campaign would be greatly appreciated. Please go to our crowdfunding page as outlined on the slide here and submit your donation. Anything that you can do to help change this culture of sexism and misogyny within healthcare will be greatly appreciated. Thank you.